March 26, 2023. You guessed it, hit that subscribe button. A lot of people probably won't watch this video. It's an update on what I got going on with my back. Last Saturday or Sunday, we were building shelves in our storage room, and I picked up a storage container full of canned foods. When I picked it up, I immediately knew I did something. It started burning from my hips and across my belly button. I thought, well, maybe I just popped a hernia, right? But I went on about my day. We kept doing what we had to do. Got the shelves installed, rearranged stuff, got everything done in there. The next day I wasn't feeling that great, woke up kind of stiff and sore, which is normal, when you injure yourself. Well, my German Shepherd Omega, I was playing with him and he jumped up and he pushed on me like that on my lower abdomen, and it instantly started burning. And in my mind, I'm thinking I got a hernia, right? I popped something out and he hit it or something. Well, I kept doing what I needed to do as far as around the house and stuff, and it kept getting worse and worse. Then about Wednesday, it got to where I could not get comfortable. I couldn't lay anywhere. I couldn't do nothing. I couldn't get up or down because it was just constantly feeling like someone was just squeezing my abdomen. If I laid down, it was in my lower abdomen. Like sitting here right now, it's in my upper abdomen. That went on for all day. And some of y'all know I'll sleep in the floor a lot when my back and stuff's acting up. So I laid in the floor, and I kept waking up pouring sweat. Just ridiculous amount of sweat. Was getting about 30 minutes of sleep, and then I'd wake up. Well, the other day rolled around. We go to the hospital, and the doctor comes in, talks to me, makes me walk around, or walk towards her. And she was asking me questions, and she said, we're going to do your blood work. We're going to do something called a drop test or something like that on your bladder. And to me, it looked like a sonogram on my bladder. They was looking for kidney stones, making sure I could empty, my bladder and stuff like that. They did a dry CT scan to look for, hernias, something going on in your abdomen or something like that. All that come back clear. And she said, Mr. we're fixing to have to do a test you may not like, and it was a digital exam. That's as far as I'm going to go in describing the digital exam. They did that, and she immediately said, we're going to order an emergency MRI. She said, you've got something going on. I said, okay. Now, I hadn't took anything except for that medicine they gave me as far as it's basically prescription Aleve. And I'm getting up and down off the hospital bed because I just can't get comfortable, right? I'm trying to move around and stuff, and they're in there talking to me, they're treating me good. Well, they said, the lady from the MRI comes in there. She said, I just saw you a few minutes ago. We did the CT scan. I said, yes, ma'am. She said, I need to ask you a bunch of questions. And you go through your questions, do you have this in your body? All this and that, And I'm like, no. I've had MRIs before. I've never had issues with it. I'm not claustrophobic or anything like that. She said, okay. She said, this MRI is going to take about 45 minutes to an hour. I said, okay. She said, can you lay still that long? She said, I see you're moving around. You look like you're in pain. I said, I think I can handle it, but I don't know. And the doctor come back in and asked me, he said, do you want anything for pain? I said, I don't really care. I kind of want to know what's going on. Well, then they gave me a shot of Dilaudid. Now, they gave it to me right before I went into the MRI, maybe 5 minutes before they come and got me for the MRI. While I'm in the MRI, I'm laying there. They put me in there. One thing, if you have hardware in your body during the MRI, that hardware is going to heat up. It gets really hot. So they try to kind of protect it, not a lot. They put something around my sides and stuff to try to lower the heat in it. And of course, they had the fan going, and they had another fan going on me. Well, about 25-30 minutes into it, the medicine wore off. And they had pulled me out and was giving me the contrast so they could do the contrast. Well, she put me back in there. And I knew something was wrong because, if you had MRIs before, you kind of know how they go. Once the MRI was done, she left me in the machine for, 5 to 10 minutes, and I could hear them talking in the little room behind me. Well, they come get me and take me back to the room, and she stops and tells them, that medicine's wore off of him. He may need another shot or something here. And also my girlfriend told him that about 30-40 minutes after I got back to the room. Well, I laid there, got up and down just like I've been doing, and then all of a sudden a nurse walks in with discharge papers. And immediately I'm thinking in my head, is this all in my head? Am I not really hurting? What's going on here? Is it just a mental thing? She said, the doctor will be here in a minute with your prescriptions. She said, you're good to go home. I was like, well, what's going on? She said, I don't know. They just told me to come in here and get you to sign your discharge papers. Well, then the doctor comes in. And while the doctor comes in, they're taking my IV out, but the lady gave me another shot before she took it out for the ride home. The doctor come in and said, you don't have no kidney stones. You have kidney stones in your kidneys. You have several of them, but that's not what's causing this. It's your spine. And she starts going in, telling me what's going on as far as, you've got real bad compression on your nerves coming out of your spine. And she said, I'm telling you, I can see this is not nothing new. You didn't just injure this. This has been going on for a while, because I'd had another MRI there, several years before. She said, it's bad. She said, but you do not meet the criteria for emergency surgery. She said, but you do have to have surgery to get this fixed. She said, it's not going to go away. It's not going to get better. It's not you're going to wake up one morning and feel better. She said, you're already, numb pretty much from your waist down. I said, yeah. And I'm thinking, why do I not meet the criteria if you're telling me I need surgery, but I don't meet the emergency criteria? And the best we can come up with is because I can still walk. Not sure on that. Well, I asked her, I said, where is this located? Where's the herniation located? She said, it's not a herniation. She said, you don't have a herniated disc in this area. She said, your hardware is causing, you've injured around your hardware, and you just keep re-injuring it. And she said, what it's doing, it's got all your nerves inflamed. Like I'm sitting here right now filming this video, my abdomen is burning from my hips around to my belly button. And she had wrote prescription, and I was looking at it, and it was prednisone. And I told her, I said, I'm not going to feel this. My doctor at the 1st of March told me my A1C was 10 or 11 on the blood work. I'm trying to get my sugar under control. She said, I checked your blood work. I would not have wrote it if your sugar was high. Your sugar is well within normal ranges. And that got me thinking, like, what's going on here? Because the doctor just called me last week and added another blood sugar medicine, right? So I'm confused on that one. Do I have high blood sugar or do I not? Because they're telling me at the doctor that did the MRI and all that's telling me your blood sugar's fine. They did an A1C and she said it's well within the normal ranges. But my doctor's telling me it's, oh, you're way up here. So I don't know on that one. But we kept talking to her, and I was trying to get her to explain to me exactly why I did not meet the criteria. Because she said, you're severe. She said, you're not moderate, you're not low, you're severe. And I apologized to her. I said, I'm sorry I wasted your time in coming here, coming over here. She said, no, you needed to come. She said, we have standards where we can admit you and do stuff, and you just don't meet the standard, or the criteria, not standard. And to this day, I don't know what that means. The only thing I can think of is no insurance, right? If I had Medicare or Medicaid or Blue Cross Blue Shield, I'd probably still be in there getting tests run like crazy, right? I mean, they would charge crap out of the insurance companies. And then she said, you got to go to this doctor Monday. And I looked at the paperwork. I said, it says on here to call Monday. That means I don't have an appointment waiting. She said, no, you got to call Monday morning. I said, well, when I chopped these fingers off, y'all sewed them back on here, and then the surgeon, y'all told me to call the surgeon and see him the next day. It took 3 weeks to see him. She was like, yeah. She said, we're not going to do that. I said, more than likely when I call this doctor, he's going to tell me to come in, 3 weeks, 4 weeks, a month, a week, or something like that from now. She said, no, if they give you any problem in that office, you call the hospital back and we will get you in immediately to this surgeon. And I'm thinking, this is going to be ridiculous, right? Because number one, I got one doctor telling me this is surgical. It's got to be fixed. And how when you go to a surgeon, how sometimes they'll want to do the surgery, and sometimes they'll be like, we want to try this. And then where do you wind up? Because I went through it with my first back, you go through the pain management where they do spinal injections, you go to physical therapy, and you still wind up at the same place where you should have started at the first time. But that's what's going on with me. It's bad. It's bad. It's got to the point where I'm ill all the time. I'm depressed. I'm at the point where it's overwhelming, honestly. I've lived in pain for several years. you know. But usually when you hurt your back, a couple days go by, it eases a little bit at least, you know, it eases up, and this is just getting worse and worse. And they told me what eventually could happen if I don't get it fixed. It's at the point where it's almost got these nerves compressed so much that I already, like sitting here now, like I told you, I'm burning hip around the belly button, and from my knees down, my feet, my legs are asleep right now, sitting here numb. And they told me it would just progressively get worse, and eventually that's the way it would be. You know, that you would not technically paralyze, but you would have no movement or control of them due to the compression, which I still don't know what that means. You should be paralyzed, right, if that's what it is. But, you know, that's the update. I know a lot of people's probably not going to watch this video, but for all y'all that commented on my post about what was going on, thank you. I appreciate it. And if you have any health issues going on right now, try to get them fixed. I know how much this is going to wind up costing, but we've got to try, because when everything goes down, and if you're like got medical issues that you can fix now, you're not going to get it fixed, and it's not going to be good for us, and we know that. Right now, medical's out there, although it is expensive, but if you got health problems, please get them fixed, or do everything you can do to try to get them fixed before SHTF. Guys, I'm going to call tomorrow morning. I'm honestly probably going to pitch a fit with them, because I consider myself a pretty tough dude, you know, but it's gotten to be too much. I can't hardly do this anymore, and I hate to say that. It's got to the point where it's just hurting me so bad and burning so bad, and you can't get comfortable. I will sleep, like I'll lay down in a few minutes and try to get comfortable, and I will sleep for about an hour, and then I'll wake up, you know, and I'll do this over and over all night. But maybe tomorrow we'll get some answers. If not, we'll definitely get them one day this week, because they told me if he can't see you, come back to the hospital. So there's the update. Stay safe, get prepped up, keep your head on a swivel, be aware of your surroundings at all times, protect yourself and your family at all times. I'm going to add one more thing to this. If you've got health problems that are fixable right now, get them fixed, or try your best to get them fixed. Stay safe, get prepped up. 12 minutes, 30 seconds. I'm sure the only one still watching or subscribed, but if you're not, please subscribe.